Our speaker tonight, let me take my time because this speaker is special. Okay. She hails from Louisiana. She is a family medicine physician. She hails from Louisiana. That's where they were bought. They gave birth to her. But Atlanta, we have adopted her through marriage. So now she's no more Louisiana. She's Atlanta made.
Amen.
She was educated at Emory University and then Duke University School of Medicine. He's a health researcher. We are starting with the heavy hitter.
Yes.
She's focused on women's health, maternal health, child health, and lifestyle medicine. The speaker tonight says she enjoys cooking and trying various foods, new foods with her husband. I'm sure our speaker tonight has not tried tuozafi. One day we'll get her to try tuozafi because she likes to try new
foods. Amen.
Our speaker tonight
is
the wife of one husband.
Hallelujah.
And her husband is our beloved brother Prince Nyaku. She is a member of PIWC Atlanta Central.
Amen.
She is the daughter-in-law of Elder and Deaconess Reynolds Nyaku. I am telling you, she's house-born, housemaid, and she is ready to give us the necessary information that we need. I introduce to you Dr. Tichelle O. Dennis.
Amen.
Amen. Dr. Nyaku, this is Atlanta District. We are ready for you.
Amen.
Thank you so much. That was so amazing. I don't think I've ever been introduced that way, so I really appreciate it. Thank you.
Amen.
Well, thank you all for having me. I'm excited to talk to you all tonight. I'll go ahead and get my slides pulled up. What I wanted to talk about tonight is really focus on women's health. There will be some things that also, include men as well, because some of these things are not just limited to women, they also are important for men as well. But I really kind of wanted to just highlight a few things that I wish some of my patients knew about. We often, just get 15 or 20 minutes with the patient and we have to get so much done in that small amount of time. So I like to kind of explain why we do things so that everyone is more informed about their health and what we need to do to stay and keep healthy. Women's health is something that's really important to me. It's something that I'm very passionate about. And I've really enjoyed during my time as a physician caring for women. It's something that is very near and dear to my heart, and some of my favorite patients are the women that I've cared for over the last few years. So as was already mentioned, I am a family medicine physician, primary care physician. I was previously at Emory, but I will be starting at Grady in just a few short weeks, and I'm excited to serve the Grady community soon. So just an outline of what we're going to talk about tonight. I'm going to review things that we should do to check for signs of cancer, whether that's early signs of cancer or cancer itself. Briefly talk about when you need to do those things, how often you need to do those things, and sometimes why we need to do certain things. And then I'll also go over other health screenings that are very important for both women and men, but with a specific focus on women. And then I'll have at the end just some lifestyle recommendations that are very helpful to help prevent cancer, but also just to in general stay healthy and live a long life. So to go ahead and get started, the first one that I wanted to talk about is cervical cancer. So cervical cancer has had a lot of changes over many years. And what I mean by that is we've come up with a lot of great tests to be able to check for cervical cancer early and catch it early to prevent people from dying. And so especially in the US, we've seen a decrease in cancer deaths from cervical cancer because of the great work that many have done before us to make sure we can catch it early. And that's not what we can say for many other diseases. So this is very unique. But all women should get checked for cervical cancer beginning at age 21. So typically once someone turns 21, up until about age 65, They should be getting regular pap smears. And pap smears, like I said, they are important tools to check for cervical cancer. And I want to highlight that because I've had more than a few patients think that, they had a pap smear and that they were checked for cervical cancer, and come to find out it was another test. And so whenever you're going to your doctor, if you are thinking you're getting a pap smear, make sure that that's what you're getting, because there are many different tools or swabs that they can use during your exam that may not always be what you need to check for cervical cancer. So if you believe that you're getting a pap smear, you can always just confirm with your doctor that that is exactly what they're doing, because I've had patients think that, what the test they got was, for a pap smear for cervical cancer, and it was not. But a pap smear, it checks for early signs of cancer, so pre-cancer and cancer itself. So how often should you get a pap smear? It depends on your age. So if you are between the ages of 21 to 29, then you need to be getting pap smears every 3 years, as long as they're normal. If you're between the ages of 30 and 65, then you need to be getting your pap smears every 5 years, as long as they're normal. The reason I highlight as long as they're normal is because if you have a pap smear that comes back and it's not normal, then that changes how often you need to get it. Sometimes you might need to start getting it every year, or maybe you might need to get it in 6 months, or maybe you might need, a procedure, different things. So I would say always check in and make sure, the results of your pap smear, that it was normal, because I have had unfortunate cases where someone got a pap smear somewhere and they never found out their results, and it came back that it was not normal, which meant that we didn't necessarily do the things that needed to be done, because they got it somewhere that wasn't in our system, and unfortunately they didn't get the results communicated to them. So I always say, take your health in when you can and make sure your results are normal, because sometimes things can fall through the cracks. The important thing to know about cervical cancer is what causes it is the HPV virus. And I bring that up because one of the best ways to prevent cervical cancer is to get something called the HPV vaccine, or the Gardasil vaccine. And that's something that people can get, or women can get, really men and women can get it, but you can get it beginning at age 11 or 12. I'll explain why they want to do that early in a little bit. But you can get that vaccine anywhere from age 11 to up until age 45. And you typically want to get it between the ages of 11 to 26, because after that, there's not as much benefit sometimes. So if you're older than 26, but younger than 45, then you can discuss with your doctor sense for you, because sometimes it might not make sense to get the vaccine. And if the vaccine is given before age 15, you typically only need 2 doses or 2 shots. If it's given 15, then you typically need 3 shots. And the reason why is because once you're older, it takes a little bit more of the vaccine to get the appropriate response. Because basically what the vaccine is doing is it's helping you fight the virus that causes cervical cancer, which is HPV. So as I mentioned, the goal of the Gardasil, or the HPV vaccine, is really to just prevent cervical cancer. And so they want to give it so young, because they want you to get the vaccine before you get exposed to the virus. Because once you get exposed to the virus, the vaccine can't necessarily cure it. So you want to get the vaccine early if you're eligible, to make sure that you have the antibodies to fight the virus if your body ever gets exposed. I commonly get asked, what are the side effects of this vaccine? And there are minimal. So the side effects that they've seen is sometimes you might have a reaction at the site where you got the shot, similar to other vaccines, where your arm might be a little sore, painful, or red. That typically goes away, does not last. Very few people, but it has been reported, sometimes might have a very mild fever. And then for people who are allergic to yeast, which are in breads and grains, they might have a more serious allergic reaction. So if that applies to you, then this would be something that you might want to avoid. One thing I did want to talk about, because I do get this quite often, is it was previously a thing where you would get a pap smear every year. So every year at your physical, you would get a pap smear. But it changed now to, like I said, if you're between the ages of 21 to 29, every 3 years, and above 30, every 5 years. The reason that it changed is for a few things. Well, one, the virus that causes cervical cancer, HPV, it takes a long time for cervical cancer typically to develop. And with that, your body has a great immune system that is often able to clear that virus. And so when you do pap smears too frequently, annually, sometimes you can catch something. So it might come back as not normal, but it's nothing to worry about because your body was going to clear it on its own. But if you act prematurely, so what I mean by that is that sometimes someone might have a pap smear that comes back not normal, but they're getting checked too frequently. And so you do a bunch of procedures. You'll do biopsies, you'll take pieces of the cervix and all those things that are uncomfortable, painful, but especially in women of reproductive age that, want to have children, it can actually affect fertility in some ways if you do all those unnecessary procedures because you're checking too often. And so this is something to definitely talk about with your doctor if you all are not following the guidelines of every 3 or 5 years. Because I do have patients that we talk about that and they're okay with whatever might come if we check it every year. And so in those cases, I do it every year for them because it makes them feel comfortable. And as long as their insurance covers it, then I see no problem. But I also explain that, like, if it comes back as abnormal, there's a chance your body could clear it. And if we do something too soon, then it causes you pain and potentially unnecessary procedures. So, guidelines now are either every 3 to 5 years. And the reason why it's changed from annually is to make sure we're not doing too much harm to patients by checking too often. So the next topic I wanted to briefly talk about is also focused centered on women. It's breast cancer screening and prevention. So the current recommendations are that women should begin getting mammograms starting at age 40. There used to be a discrepancy where some organizations said start at 40, some said start at 50, but now they all seem to be on the same page of start screening for breast cancer with the mammogram at age 40. And they typically say you can get a mammogram every year or every other year up until age 74. I typically recommend my patients get it every year, but you can discuss with your doctor whether you want to do every year, every other year. What's really important in deciding that is your family history, your personal history, because if there is an increased chance of you getting breast cancer because it runs in the family or you've had some abnormalities before, then you might want to do more frequently. With this, though, whether you want to do every year or every other year, insurance typically covers it. I haven't had any issues with that. And just a little bit about mammograms. They're basically x-rays of the breast to check for any signs of precancer or cancer. And the reason why, they sometimes don't want to do more frequently than they recommend is because it is radiation. So you want to limit the amount of radiation you are exposing women to. Ways to prevent breast cancer. So a theme that you'll see throughout this presentation is a lot of the things that I recommend can help prevent all of these things. So making sure you're at a healthy weight, you're getting regular exercise, you're avoiding. There's a recent study that came out that showed that as the amount of alcohol you drink increases, so does the risk of cancer for many different types of cancer. So I typically say if you can avoid alcohol, completely avoid it because it is really bad for your health. And then for certain women, they might be taking certain medications. It could be hormone replacement therapy or birth control pills for various reasons. You commonly see those sometimes in instances where it could be someone went into early menopause or are having really bad menopause symptoms, and so they're taking these medicines. But when it comes to breast cancer, you want to make sure you've had a well thought out conversation with your doctor about your breast cancer risk, because there are certain scenarios where you should not take those medications, because if you have a higher risk of breast cancer, then it can increase the chances that you might develop it, because those hormones, the birth control pills, the hormone replacement therapy, they have estrogen in it, and that can often sometimes increase the risk of developing breast cancer. So important, if you need to take those medicines, make sure it's the right one for you and discuss that with your doctor. One thing that I think is so great to know if you're able to do so is breastfeeding, because breastfeeding has been shown, a lot of studies have shown that if you breastfeed, it can lower the chances that you'll develop breast cancer. So for women that are able, I highly recommend breastfeeding because of the benefits it has for not just reducing breast cancer risk, but it lowers the chances of developing other cancers, diabetes. It's really helpful for women's health. And then lastly, if you do have a family history of breast cancer, then I do encourage you to discuss with your doctor whether or not you might benefit from genetic testing, because there are certain tests that we can do to see if you have certain genes that might increase your risk of breast cancer. And if they find that out, then there are things that they can do to lower the chance that you will develop breast cancer. The next one is colon cancer. And so this is not specific to just women. Both women and men need to get screened or checked for colon cancer. And there are many ways to do this. I'll go, my next slide kind of details some of those ways. But the big thing to know about this is that you want to start getting checked for colon cancer beginning at age 45. It used to be age 50, but a few years ago, around the time I believe the actor Chadwick Boseman passed away, the age changed from 50 to 45. The only time that varies is if you have a family history, for example, of colon cancer, if your family has a history of something called Lynch syndrome or other certain diseases. If you have it yourself or it runs in your family, then you might need to get checked a little bit earlier. And the example I want to give for this is, okay, say we have a random made up person named John Smith, and John Smith has a first degree relative. So say, unfortunately, John Smith has a sibling who unfortunately gets colon cancer at age 40. Because John had a first degree relative that had colon cancer at age 40, he's going to need to get screened earlier than that. So the rule is if you have a first degree relative with colon cancer, then you need to start getting checked for colon cancer 10 years before their diagnosis. So if John Smith had a sibling that was diagnosed with colon cancer at age 40, that means John needs to start getting checked for colon cancer at age 30. And I'd say that that's very important because a lot of people get missed because they may not know that rule. And so they never bring it up. And then, colon cancer is actually increasing and it's happening at younger ages now. So it's really important that if there's any family history in the first degree relatives, so parents, siblings, that you know the age that they were diagnosed with colon cancer so you can start getting screened 10 years before they were first diagnosed. And how can we check for colon cancer? That is usually with the colonoscopy, but there are many other options. I typically recommend a colonoscopy, and I'll talk about why on the next slide. But there are many different options. So a colonoscopy, if you can see on this slide, it's the top left picture. Long story short about a colonoscopy, it's basically a procedure where you are put to sleep. So you do have to undergo some anesthesia. They put you to sleep. The day before colonoscopy, you do have to do something that people hate, which is you typically have to drink this laxative to clean out the bowels. And the reason they do that is because they need to get the bowel completely clear so that they can see everything. And so they typically insert basically a flexible tube with a camera through the entire colon, your intestines, to see if there are any signs of early cancer or cancer. The reason why I highly recommend my patients get a colonoscopy over any of these other tests is for a few reasons. One, if it's normal, you only have to do it every 10 years compared to some of the others where you have to do more frequently. Two, if they see something, then you can do something about it more quickly. You can go ahead and take a sample so that they can see what it is. And then the last reason I would say that I really like my patients to get this is if we see something as abnormal, then we know when we need to follow up on that. Not many, these other tests, they can't tell me, oh, okay, we saw something abnormal, so I want you to follow up in 3 years or 5 years or 7 years, whereas a colonoscopy can't do that. And so I like all the benefits it provides for making sure we catch something and catch it early. I do understand though that people hate drinking the laxative to clean out their bowels and they are always a fan of the anesthesia, but it has been very helpful in detecting early cases of colon cancer. And just for context, of all the colonoscopies I've seen, I can count probably on one hand the number of times I've had a normal colonoscopy. So many people have signs of early cancer or just things that are not normal in the colon. So it's quite common to be able to catch things early, and a colonoscopy is the best way to do that. There are a number of other tests on this slide that I'll just briefly talk about. There's a lot of things you can do where you submit a stool sample. Some of those you have to do every year, some of those every 3 years. If those are things you would like to do, I would recommend discussing that with your doctor. And then there's other things, more invasive procedures, but again, those are, you just have to do it a little bit more frequently than a colonoscopy. How can we prevent colon cancer? So making sure you're a healthy weight, avoiding alcohol, avoiding smoking, going to your doctor regularly to make sure you're getting all of your necessary health screenings, and eating a healthy diet. When it comes to colon cancer, it's very important to have a diet that is full of whole fruits and vegetables, whole grains, lean meats like chicken and fish, low-fat dairy, beans, and the nuts. And you want to make sure you avoid red or processed meats, added sugar, alcohol, and processed and fast food. A good rule of thumb is to avoid shopping on the aisles of the grocery store because that's where you have all of the processed food. If you shop on the periphery, that tends to be where you have the less processed food, your fruits, your vegetables. I'll just briefly touch on this. All people, men, if you've ever smoked, currently smoked, then you need to get checked for lung cancer beginning at age 50. But you have to have smoked a certain amount. So typically, like it says, a 20-pack year history. What that means is if someone smoked a pack of cigarettes a day for 20 years, then they need to get checked for colon cancer beginning at age 50. And you typically do that with a CAT scan of the lung every year. Heart disease screening. So the guidelines for this have changed over the years. And so they don't necessarily say when you need to start checking for things like cholesterol, but I typically check cholesterol in all of my patients if they're coming for a physical, but you can begin at age 20. And then how often you need to recheck that cholesterol depends on whether or not it was normal. A part of heart disease screening is also checking blood pressure. So I typically say everyone should have an annual physical. Even if you think you're healthy, please go get a physical because there have been many times where someone thought they were healthy and then they come in the office, their blood pressure is a little elevated, or maybe with the labs I get, their kidney numbers are a little elevated and they didn't know about it because a lot of these things are silent diseases. You can't always feel them. So making sure you're getting your cholesterol checked, you're getting your blood pressure checked at least once a year, once you're 18 and older. And then if those are not normal, then discuss with your doctor how often you should follow up to make sure you're getting checked frequently. I like to say if your blood pressure is abnormal, then I would buy a home blood pressure cuff. Avoid like the wrist cuffs because sometimes they're not always as accurate. Make sure it's one that fits appropriately on your arm. And a normal blood pressure will be less than 120/80. And so if you've ever had abnormal blood pressure, I would say make sure you check it at home a few times a week because that tends to be a more accurate measurement of your blood pressure than when you go in the office because sometimes people's blood pressure shoots up just because, they might be a little bit nervous about being at the doctor's office. The next topic I wanted to talk about is it can affect men, but it's more common that we check in women. And I'll talk a little bit about why. And it's osteoporosis. So osteo, that means bone. And so what osteoporosis is, it's when your bones become very, very thin. And that's dangerous because when your bones have thinned in a way that's not normal, it can place you at a high risk of breaking a bone from minor things. So minor bumps, minor accidents, and your bone breaks. And it's because your bones are too thin. The reason I said, this is more so with women is because it's hormone related. Once women enter menopause, they have much lower levels of hormones than they had premenopause, and that is all important in your bone strength. So beginning at age 65 is typically when you should start getting checked for osteoporosis. This is why I say there's a lot of information here about, you need to start at this age and that age. And I don't necessarily expect you to remember all of these ages, but I think it highlights the importance of going to your doctor every year for your physicals because there are certain things that they will know that you need to get checked based on your age. And these guidelines can change. So things that I'm saying today could change next year. And so it'll be important to go to your doctor because maybe at whatever age you are next year, there will be something new that you will need to get done to make sure you stay healthy. But as I was saying, to check for osteoporosis or thinning of the bones, you start to get a scan every 5 years or so. beginning at age 65. And that scan is called a DEXA scan. And what that is basically x-rays of certain bones in your body to see how thin they are. Some instances where you do need to start checking for osteoporosis before age 65. But again, that's why I encourage you to get your regular physicals, because you and your doctor should discuss, they should kind of be aware of your health to know, okay, you meet these risk factors, you might need to start getting checked for it early. Some of those risk factors, just so you're aware, is if someone entered menopause early. So if they entered menopause maybe in their early 40s for something, there might be a scenario where they need to start getting checked for this condition earlier than 65. Um, if someone has been underweight for most of their life, then that is a risk factor for having thin bones, and you might need to get checked for osteoporosis. And then certain medications. So if you're taking chronic steroids, that can sometimes affect the bones, then that might change things as well. How can we prevent osteoporosis or thinning of the bones? Like I said, many of these things kind of are the same throughout each topic, but avoiding smoking, avoiding alcohol, making sure you're getting enough calcium in your diet, whether that's through dairy products like milk, yogurt, or cheese, eating very dark leafy green vegetables like kale and broccoli. And there are calcium fortified foods, but sometimes those tend to be a little bit more processed. So getting it from the unprocessed foods as much as you can. Making sure you maintain a healthy body weight. As I mentioned, if you're underweight, it can increase the chances of this happening. Making sure you're getting enough vitamin D. I've had a lot of patients that I've checked the vitamin D on in the last few years, and it's many people are low in vitamin D and deficient. So this is something to consider getting checked with your doctor, because you might need to take a supplement that only your doctor can prescribe. Yes, you can get vitamin D over the counter, but there are some times where you need a higher dose of vitamin D that we need to prescribe. But other ways to naturally increase your vitamin D is getting sunlight. Our body actually can produce vitamin D itself, but the way that it does that is by being exposed to the sun. So making sure you're getting appropriate sunlight and wearing sunscreen if you're out for very long, because no matter the complexion of the skin, we see skin cancer, and especially with the environment changing, we're seeing increasing rates of skin cancer. So making sure you're protecting yourself as well if you're out in the sun for a very long time. And then also you can get it vitamin D through fatty fish and other foods and supplements. And then lastly, for osteoporosis, making sure you're doing strength training. And what that means is training with weights, because that helps build your muscles, builds your bones. Ideally, you want to start this as early as you can, because you don't get as much benefit when you start it later in life, although it's still beneficial and can help prevent things, no matter what age. So pre-diabetes and diabetes, we begin checking for this at age 35 in people who are overweight or obese. But honestly, all of these are the recommended guidelines. I sometimes veer out of that. And what I mean is I might check for it a little bit earlier than 35 based on the patient that I'm seeing and what they're telling me, because it can happen at any time, and we're seeing it earlier and earlier now. But typically how we check for that is we get a test called the hemoglobin A1C, or A1C for short. And what that is it's an average of your blood sugars over the last 3 months. So I say that because sometimes I'll have patients say, oh, my A1C was a little high that day because I ate something really bad that day, or I ate bad a lot that week. Now, while it definitely is affecting your blood sugars if you ate bad that day or that week, because the A1C is an average of your blood sugar over the past 90 days, I wouldn't expect what you did that week or that day to significantly shoot it up. I would expect it to be a more broad picture of how your blood sugars have been doing over 90 days, not just 7 days or one. If it comes back as abnormal, I would say you would need to get it checked more frequently and make some lifestyle changes that I've kind of already talked about, but I'll talk about a little bit more later. This is one that I would say, in general, make sure you follow up with your doctor about your test results. But I've commonly had patients that, maybe they saw a different doctor, then they come to me and they were talking about their results. And I mentioned that their A1C is in the pre-diabetes range, and they're shocked because it's the first time that they've heard that. And so I like to say, kind of with everything, make sure you're taking charge of your health and you're making sure that your lab results are being communicated to you. Because I have often seen where people didn't know about their results and it was a little bit abnormal and they wish they had known because they would have made certain changes. So whether that's for a pap smear, colonoscopy, your A1C, make sure your doctor is communicating those results to you. Other important screenings that I'll just briefly mention, checking for hepatitis B and C. This is a simple blood test. You usually just get it once. Women get it often, maybe more than once with pregnancy, hepatitis B, but hepatitis B and C at least once in the lifetime. And then a really big recommendation that I wish we talked more about is prenatal vitamins. So if you are someone that can become pregnant, so if you're having menstrual cycles, even if, you know, pregnancy isn't desired, it's always important to make sure you're taking a prenatal vitamin with at least 800 micrograms of folic acid. And the reason I say it that way is because if by chance, you know, someone becomes pregnant, whether it was expected or not expected, usually by the time someone finds out that they're pregnant, they've missed the critical window to have that folic acid. And that can place the baby at risk for having many different neurological abnormalities, things going, you know, awry with their nervous system. And it can take a while for the body to build up those vitamin stores. So I say, if there is any chance, even if it's a 1% chance that you could become pregnant, make sure you're taking a prenatal vitamin because it has many other vitamins that are important, but also the crucial vitamin of folic acid that would be needed to make sure the baby does not have any nervous system abnormalities. With that, I say beware of some of the gummy prenatal vitamins because they do not always have the recommended amount of folic acid. So sometimes they'll have 400 instead of the recommended 800 micrograms of folic acid. And make sure you're taking it with food because it helps the body absorb it. So make sure you're reading the instructions on the vitamins. If pregnancy is not an option, meaning there's a 0% chance that you could become pregnant, then I would say taking a one-a-day woman's multivitamin should be sufficient. So I'll end with some healthy lifestyle tips. Water intake is something that I think is really important. And I say that because I'll have patients come in for many different things and we'll find out that they're not drinking enough water. This is something I personally experienced over the last few years where I wasn't drinking enough water and I was having headaches, feeling tired all the time. And then I did something simple as buying one of my coolers and I fill it with water. I take it everywhere with me. And I've noticed I get less headaches and I tend to have more energy because our body is made up of such a large amount of water. It is so important to the functioning of our body, making sure all of our organs are working the way they should. And so water is something so important, but in my talk with patients, many patients do not drink enough. And with it being the summertime, if you're visiting hotter climates, if you're more physically active, or if you're sick, all those are times where you need to drink even more water than you normally do because your body has a higher requirement. So how much water should you drink? Typically, you get about 20% of the water that your body needs every day through the food you eat because our food has a lot of water. Fruits and vegetables have a lot of water and are a great source of getting natural water into your body without drinking it. So if we take that into account, then you typically need about 9 cups of water per day. This says fluid, but I'll just say water per day because that's what your body needs. It really doesn't need anything else. But I like to say that with caution because you ultimately should check with your doctor to confirm the right amount of water for you. The reason I say that is because there are some health conditions that you may or may not know that you have where you actually have to drink less water. The things I'm thinking about is if I have a patient with a heart condition or a patient with a kidney condition, sometimes they cannot drink a certain amount of water because it might worsen their condition. And so it's important to make sure you're drinking the right amount of water for your body weight and for your health conditions. Some tips to drink more water is, like I said, I have my reusable water bottle that keeps my water cold. I take that around with me everywhere. When you're in certain scenarios, try choosing water over sugary drinks. If you're eating out, which you try to limit that, but consider drinking water over other beverages. Try to only drink water with your meals. And then some people don't always like the taste of water, so you can consider adding a wedge of a lime or a lemon to your water. Healthy eating. So this is a healthy plate from Harvard School of Public Health, and it basically just shows all the things that comprise a healthy meal for you. So if you look at it, you have your water, which we talked about, making sure you're drinking enough of that a day, limiting dairy and milk and juice as well, and then healthy oils, cooking with healthy oils as much as you can, thinking of olive oil, canola oil. Um, when it comes to those oils, though, I will say um, could, olive oil burns very quickly at very low temperatures. Canola oil tends to be better and doesn't burn as quickly as olive oil. So I tend to use canola oil in my cooking over olive oil and definitely over vegetable oil because vegetable oil does not have the healthy fats, whereas canola oil and olive oil have healthy fats in them that are very good for our body. So I tend to use canola oil, but olive oil is really great, has great health benefits. You just kind of have to be cautious with burning it. The reason why is because if you burn it and it gets too hot, it can actually change into things that are not healthy for your body. So if you're cooking with those healthy oils, just be mindful of the temperature that you're cooking at because you don't want to burn it and get it too hot. Um, as far as what should be on your plate, as you can see, the green part, the vegetables, a large portion, almost a half of your plate should be vegetables. And as it kind of says here, potatoes and French fries do not count because while they can fill your plate, they're not as nutritious and they're really high in carbs. And then a smaller portion should be fruits. With the vegetables and fruits, we like to say eat the rainbow. So the more colorful your plate is, the better. A fourth or about 25% of your plate should be whole grains. So that should be whole wheat bread or whole grain pasta or brown rice. White rice of any kind is typically, unfortunately, while it tastes good, it can be very unhealthy for you. But it's not necessarily avoid white rice. It's just try to limit how much of it because it is processed, unfortunately. And then about a fourth of your plate or 25% should be fish or chicken, beans and nuts. Again, avoiding red meat, bacon, cold cuts, processed meats. So we're almost to the end here. These are some exercise recommendations because exercise is also very important to preventing all of the diseases we talked about earlier on. And the typical recommendation for most adults is to get about 150 minutes of, they call it moderate intensity aerobic activity. That's a fancy word for, it's basically just telling you how active you need to be. So if you're doing moderate activity for 150 minutes, that might be a brisk walk. So you might break it up and do a 30-minute brisk walk where you're walking very quickly 5 days a week.
Who be this?
Another option is you can do vigorous activity. So vigorous is more than moderate. So that means you're jogging, that means you're running, and you need to do that 75 minutes. So you can either choose to do moderate activity where you're doing 150 minutes, or you can do vigorous activity where you're doing 75 minutes. And you want to spread that out over 5 days a week. And then with any of these, you want to make sure that you're getting your muscle strengthening activities. So that's like your weight training. And you want to do that on at least 2 or more days of the week, working all of the major muscle groups. So whether you want to do brisk walk 150 minutes a week or running or jogging for 75 minutes, you can kind of choose your path. You can combine the two, but also make sure you're doing your strength training with weights. If you go on the CDC's website, they have more examples of what might count as a moderate activity because there are things beyond just brisk walking that can count for moderate or vigorous. So the CDC is a great resource for not only like healthy eating tips, but also things you can do for exercise. So the last thing I'll talk about for healthy living is sleep. Sleep is something that sometimes is greatly underestimated with how important it is for your health. But adults, I highlight need here because it's not something that, oh, maybe you can get it in, you need at least 7 to 9 hours. Now, there are very rare people that fall out of that. They might need less, like 6 or 5, or they might need more, like but most adults fall into the 7 to 9 hours of uninterrupted sleep. Um, and that's very important. This is just kind of pictures of 20 reasons of why sleep is important. The first one shows that sleep is important for learning and memory. So when we learn throughout the day, we're taking in all of that information. When we go to sleep at night, our brain is actually storing all of that information. So if you're not getting good sleep and restful sleep and sleep for the recommended time, then your brain is not able to store that information you learned. And that was definitely something I remember when I was in school, when I would, stay up all night and I didn't get my good sleep. It was harder for me to remember the things that I worked so hard studying for. So no matter what you do, whether it's work, whether it's school, making sure you're getting a good night's sleep is important to making sure what you're learning is being stored, because that not only affects your memory from the day to day, it can affect memory later on in life too. When you get good sleep, it also is really good for your emotional health. It helps to prevent depression, anxiety. It's just really good for your emotional well-being. It helps with healthier, younger looking skin. Um, it's really important for heart health. We've had a lot of research and studies showing that, if you're not getting good sleep, it can severely impact your heart. And so making good sleep is very important to making sure your heart stays healthy. As we expect, it gives you energy. It can also help regulate your blood sugar, help you focus, concentrate, help with weight loss, help with, being able to exercise. Getting good sleep increases your lifespan and it enhances your immune system. And what I mean by that is, you might know that, oh, if you haven't gotten as much sleep or as much rest, maybe you're getting sick more often. I know that's something I've definitely experienced when I don't get as much sleep. Um, but it's not just getting a cold or things like that. Um, our immune system is very important for fighting things like cancer. And so, if we're thinking about our overall health and our long term health, getting sleep helps our immune system not just fight colds, but it can also help prevent cancer. So, sleep is just so very important for so many different things. Like I said, it helps people emotionally feel better. So, it helps you feel happier, reduces your stress level, reduces your cancer risk, healthier for your liver, helps you be more creative, build muscle, improves your, productivity, ability to be functional at work or school. And then also, it helps you to drive safely and reduces the chance of accidents happening. So sleep is so very important. And if you are unable to get good sleep, say, I have a lot of patients come in with insomnia, they're waking up during the night or different things. That's something to talk about with your doctor because it would be beneficial to figure out why you're not sleeping well so that we can ensure that you're getting the sleep that your body needs to heal and to be as strong as it possibly can be. So, just to summarize all of the things that I've talked about this evening. Um, so, colon cancer screening, that's something that's, very important that needs to be done beginning at age 45, but discuss with your doctor because if you have a family history of certain things, you might need to start earlier. Lung cancer screening, again, if there's a history of tobacco use, discuss with your doctor to see if you need to get screened for lung cancer. Heart disease screening, osteoporosis screening should be started at age 65 unless, there are certain you started menopause early, you might just start a little bit earlier. Getting checked regularly for prediabetes and diabetes, getting checked for hepatitis B or C at least once in your lifetime. If you can become pregnant, taking a prenatal vitamin with 800 micrograms of folic acid, or simply taking a woman's multivitamin. Making sure you're getting 7 to 9 hours of uninterrupted sleep if you can, drinking enough water, making sure you discuss what enough water looks like for you with your doctor to make sure it's safe, getting regular exercise and eating a healthy diet. And the one thing that I forgot to include on this slide is the cervical cancer screening. We start that at age 21 and then continue until age 65, making sure you discuss your results with your doctor so you know how often you should be getting those done. So that is all I have to discuss this evening, but I thank you all for your time, for allowing me to meet with you all and speak with you all. I would love to take any questions, but if there are no questions, God bless you all.
Thank you very much, Dr. Nyako. What do we all say to Dr. Nyako tonight?
God bless you.
God
God
bless.
will bless you.
Thank you very
God
much.
bless you.
God bless you.
God bless you.
God bless you.
At this time in our gathering, we will take some questions. Dr. Nyako is available for any questions that you have. So far, I haven't seen any questions in the chat. So if you're ready, you can raise your hand. And then we'll take your question and she'll answer it for you.
There's a question in the chat.
Okay.
I see it. Oh, how many milligrams of vitamin D? So I typically, if you've never had your vitamin D level checked, I would, recommend getting it checked just so you know. But to be on the safe side, I would recommend taking at least 1,000 to 2,000 international units a day. So vitamin D, it comes in, or on the bottle, you'll see something called IU, and what that stands for is international units. So I'd recommend taking anywhere from 1,000 to 2,000 international units a day. But there are some scenarios where, say, your vitamin D level is 12, it should be above 30. Then I have those patients take a much higher dose, and it's only something that I can prescribe. So that's why I recommend, consider getting your vitamin D level checked at least once. But if, you haven't gotten it checked or you just kind of want something to take, then anywhere from 1,000 to 2,000 international units. And so make sure you're seeing 1,000 or 2,000 international units because that's a little bit different from milligrams. And that's usually how they have it on the bottle of vitamin D.
Thank you. Any more questions? Is taking your womb the best recommendation if you have cancer?
That's a complicated question because it depends on what type of cancer it is, what type of cancer it is, and how far the cancer has spread. Because there are some scenarios. I actually had a family member who had uterine cancer, and they did have to take her womb out, her uterus out. She had to undergo chemotherapy and all those things, but then they also had to take her uterus out. Fortunately, she's been cancer free. But there are some scenarios where that might be the best recommendation. So if you've received or if someone has received a recommendation to have their womb removed, then I always say it's never wrong to get a second opinion to make sure, you're getting the best recommendation.
Thank you. Questions? The floor is still open for questions. We have a little bit of time. Dr. Nyako, give me 1 second. I just need to transfer this in Chi a little bit.
Okay, no worries.
Yes, Remo. More questions now, Mutabusa, our hallway. No. And then at the best time, your family medicine practitioner, our physician, on your BBR from head to toe. Question BR will for BBR who be fa ato on my na into me